Safe patient handling, positioning. Patients who spend a lot of time in bed often need help getting into comfortable positions. They also need to change positions periodically to avoid muscle stiffness and skin breakdown. Positioning means helping patients into positions that promote comfort and health. Remember, bed-bound patients should be repositioned at least every 2 hours. Patients in wheelchairs or chairs should be repositioned at least every hour. Which position a patient uses depends on the diagnosis, the condition, as well as the patient's preference. The care plan will give specific positioning instructions. When positioning patients, HHAs must use proper body mechanics to help prevent injury. HHAs should also check the skin for any problems, such as whiteness, redness or warm spots, especially around bony areas, each time they reposition patients. Safe patient handling, positioning. The following are guidelines for positioning patients in 5 basic body positions. 1. Supine. In this position, the patient lies flat on the back. To maintain correct body position, the head and shoulders should be supported with a pillow. Pillows, rolled towels or washcloths can also be used to support the arms, especially a weak or immobilized arm or hands. A pillow should be placed under the calves, so the heels are elevated and do not touch the bed. Pillows or a footboard, padded board placed against the patient's feet, can keep the feet positioned properly. Safe patient handling, positioning. The following are guidelines for positioning patients in 5 basic body positions. Continued. 2. Lateral side. A patient in the lateral position is lying on either side. There are many variations of this position. Pillows can support the arm and leg on the upper side, the back and the head. Ideally, the knee on the upper side of the body should be flexed. The leg is brought in front of the body and supported on a pillow. There should be a pillow under the bottom foot, so that the toes and ankle are not touching the bed. If the top leg cannot be brought forward, it should be placed slightly behind the bottom leg, not resting directly on it. Pillows should be used between the 2 legs and ankles to relieve pressure and avoid skin breakdown. Safe patient handling, positioning. The following are guidelines for positioning patients in 5 basic body positions. Continued. 3. Prone. A patient in the prone position is lying on the stomach or front side of the body. This is not a comfortable position for many people, especially the elderly. The HHA should never leave the patient in a prone position for very long and should check the care plan before using the prone position. In this position, the arms are either placed at the sides, raised above the head, or one is raised and one is by the side. The head is turned to one side and a small pillow may be used under the head and legs. This keeps the feet from touching the bed. Safe patient handling, positioning. The following are guidelines for positioning patients in 5 basic body positions. Continued. 4. Fowlers. A patient in the Fowler's position is in a semi-sitting position, 45 to 60 degrees. The head and shoulders are elevated. The patient's knees may be flexed and elevated, using a pillow or rolled blanket as a support. The feet may be supported using a footboard or other support. The spine should be straight. In a high Fowler's position, the upper body is sitting nearly straight up, 60 to 90 degrees. In a semi-Fowler's position, the upper body is not raised as high, 30 to 45 degrees. Safe patient handling, positioning. The following are guidelines for positioning patients in 5 basic body positions. Continued. 5. Sims. The Sims position is a left side lying position. The lower arm is behind the back, and the upper knee is flexed and raised toward the chest, using a pillow as support. There should be a pillow under the bottom foot, so that the toes and ankle do not touch the bed. Safe patient handling, positioning. The patient's care plan indicates the positions that should be used. If an HA has questions about how to position a patient, the HA should ask the supervisor. In general, positions that are natural and comfortable for the patient should be used. When moving or positioning a patient, an HA should use proper body mechanics to promote safety. Avoid lifting. It is safer to push, roll, slide or pivot, rather than bearing the patient's weight. Help a patient move up in bed to prevent skin irritation that can lead to pressure injuries. An HA should get help if he or she thinks that it is not safe to move the patient by himself or herself. If a patient cannot help with moving, a draw sheet, turning sheet, transfer sheet or glide sheet should be used. A draw sheet is an extra sheet placed on top of the bottom sheet when the bed is made. Draw sheets help prevent skin damage caused by rubbing or friction. Safe patient handling. Transfers. Transferring a patient means that a home health aide is moving the patient from one place to another. Transfers can move patients from a bed to a chair or wheelchair, from a wheelchair to a shower or toilet, and so on. Safety is one of the most important things to consider during transfers. When transferring, it is necessary to know that some patients have a weaker side. The weaker side is called the involved or affected side. The HA should plan the move, so that the stronger side moves first, and the weaker side follows. It is difficult for the weaker arm and leg to bear enough weight for the transfer if moved first. Safe patient handling. Using a transfer belt. A transfer belt is a safety device used to transfer patients who are weak, unsteady or uncoordinated. It is called a gait belt when used to help patients walk. The belt is made of canvas or other heavy material, and it is a strong buckle and sometimes has handles. It fits around the patient's waist, outside the clothing, with the buckle tightened until it is snug. The transfer belt should never be placed on bare skin. It is important to check female patients to make sure the breasts are not caught under the belt. The transfer belt gives the HA something firm to hold on to when assisting a patient with transfers. The HA should grasp the belt securely on both sides, with hands in an upward position. Transfer belts cannot be used if a patient has fragile bones, fractures or has had certain kinds of recent surgery. Guidelines for HAs, wheelchair transfers. Learn how each wheelchair works. Patients may use manual or electric wheelchairs. Know how to apply and release the brake and how to operate the armrests and footrests. Always lock a wheelchair before assisting a patient into or out of it. After a transfer, unlock the wheelchair. To transfer to or from a wheelchair, the patient must use the side of the body that can bear weight to support and lift the side that cannot bear weight. Patients who can bear no weight with their legs may use leg braces or overhead trapezes to support themselves. Before any transfer, make sure the patient is wearing non-skid footwear that is securely fastened. This promotes patient's safety and reduces the risk of falls. Guidelines for HAs, wheelchair transfers. During wheelchair transfers, make sure the patient is safe and comfortable. Ask the patient how you can help. Some may only want you to bring the chair to the bedside. Others may want you to be more involved. Always be sure the chair is as close as possible to the patient and is locked in place. Use a transfer belt if you are going to assist with the transfer. Be sure the transfer is done slowly, allowing time for the patient to rest. Upon standing, check to see if the patient is dizzy. If the patient is, help him or her sit back down. Measure vital signs as ordered and report to the supervisor. Check the patient's alignment in the wheelchair once the transfer is complete. The patient's body must be in proper alignment while in a wheelchair or chair. Special cushions and pillows can be used for support. The hips should be well positioned back in the chair. When a patient is in a wheelchair or a chair, he or she should be repositioned at least every hour. The reasons for doing this are as follows. It promotes comfort and muscle tone. It reduces pressure. It increases circulation. It exercises the joints. No. HA safety and proper body mechanics. Back strain or injury is a serious problem for home health aides, as they may position or transfer patients while providing care. Using a proper body mechanics is an important step in saving energy and preventing injury. Below are the most common hazards that lead to injury: poor posture, failure to prepare, incorrect movement, failure to wear slip-resistant footwear, combative or uncooperative patients, unpredictable behavior such as sudden resistance or grabbing, space limitations, lack of assistance, lack of assistive devices, tight or restrictive clothing that inhibits movement, moving too quickly, not working at an appropriate height, for example, when the back is stooped. No. HA safety and proper body mechanics. Define the following key terms. Body mechanics: the way the parts of the body work together when a person moves. Alignment: the way the head, shoulders, spine, hips, knees and ankles relate and line up with each other. Posture: the way a person holds and positions the body. A person can maintain the correct body alignment when lifting or carrying an object, while keeping the object close to the body. The feet and body should be pointed in the direction the person is moving. Any twisting at the waist should be avoided. Base of support: a person's feet that are the foundation that provides support when standing. Center of gravity: the point in the body where the most weight is concentrated. HA safety and proper body mechanics. The ABCs of good body mechanics. 1. Alignment. When standing, sitting or lying down, you should try to keep your body in alignment. It means that the two sides of the body are minor images of each other, with body parts lined up naturally. 2. Base of support. The feet are the body's base of support. It means they are the foundation that supports you when you stand. The wider the base of support, the more stable it is. A person who is standing with legs apart has a greater base of support and is more stable, rather than someone standing with the feet close together. 3. Center of gravity. The center of gravity in your body is the point where the most weight is concentrated. This point will depend on the position the body is in. When you stand, your weight is centered in your pelvis and, therefore, lowers your center of gravity. It gives you more stability and makes you less likely to fall or strain the working muscles. Guidelines: using proper body mechanics. The following guidelines are helpful for HAs to properly position or transfer patients, while prevent injury. Assess the situation first and prepare the environment. Clear the path and remove any obstacles. Use both arms and hands to push or carry objects. When lifting an object from the floor, spread the feet shoulder width apart. Bend your knees. Use the strong, large muscles in your thighs, upper arms and shoulders to lift the object. Raise your body and the object together. Hold objects close to you when you are lifting or carrying them. This keeps the object closer to your center of gravity and base of support. Push or slide objects rather than lifting them. Never attempt to lift a patient alone. Get help and consider using assistive devices. If you need instructions or have any questions, notify the supervisor and the agency. Guidelines: using proper body mechanics. The following guidelines are helpful for HAs to properly position or transfer patients, while prevent injury. Continued. Avoid bending and reaching. Position the furniture, so that you do not have to bend or reach. If you are making an adjustable bed, Adjust the height to a safe working level, usually waist high. If you are making a regular bed, lean or kneel in order to support yourself at working level. Avoid bending at the waist. When a task requires bending, use a good stance. Bend your knees to lower yourself, squat, rather than bending from the waist. This uses the big muscles in your legs and hips rather than the smaller muscles in your back. Do not twist when you are lifting or moving an object. Instead, turn your whole body. Pivot your feet instead of twisting at the waist. The feet should point toward what you are moving or lifting. Guidelines: using proper body mechanics. The following guidelines are helpful for HHAs to properly position or transfer patients, while prevent injury. Continued. Talk to patients before moving them. Let them know what you will do, so that they can help if possible. Agree in a signal, such as counting to 3. Lift or move on 3, so everyone moves together. To help a patient sit up, stand up or walk, place your feet 12 inches or shoulder width apart. Put one foot in front of the other and bend your knees. Your upper body should stay upright and in alignment. Do it whenever you need to support a patient's weight. Never try to catch a falling patient. If the patient starts to fall, assist the patient to the floor. If you try to reverse a fall in progress, you could injure yourself or the patient. Report to the supervisor any task that you feel you cannot safely perform. Never try to lift a patient or an object that you feel you cannot handle. Make sure the homes that you work in are safe for your patients and you. Working in a home that is neglected puts you at risk for injury. Look for safety hazards. Immediately notify the supervisor about any hazards you observe when at work. Summary: HHA safety and proper body mechanics. HHAs should always keep the following tips in mind to avoid strain and injury. When standing for long periods, stand with feet apart and one foot slightly forward. Keep your back straight. Squat instead of bending. Use both arms and hands when pulling, pushing or carrying objects. Hold objects close to you when you are lifting or carrying them. Push, slide or pull objects rather than lifting them. Move or position furniture, so that you do not have to bend or reach. Avoid twisting at the waist. Let the patient know what you will do, so he or she can help if possible. Count to 3 and lift or move on 3, so everyone moves together. Report to the supervisor if your assignments include tasks you feel you cannot safely perform. Never attempt to lift a patient or an object that you feel you cannot handle. No. Observing and reporting skin changes in patients. During daily care, a patient's skin should be observed for changes that may indicate injury or disease. Home health aides should observe and report the following signs and symptoms to the supervisor immediately: pale, white, reddened, gray or purple skin, blisters or bruises on the skin, differences in temperature of the skin when compared to the area around it, complaints of tingling, warmth or burning of the skin, dry, cracked or flaking skin, itching or scratching, rash or any skin discoloration, swelling. Observing and reporting skin changes in patients. HHAs should observe and report the following signs and symptoms to the supervisor immediately. Continued. Cuts, boils, sores, wounds or abrasions. Fluid or blood draining from the skin. Broken skin anywhere on the body. Changes in moistness or dryness. Changes in existing injury or wound. Size, depth, drainage, color or odor. Redness or broken skin between the toes or around the toenails. Scalp or hair changes. Skin that appears different from normal or that has changed. In darker complexions, look for changes in skin tone, skin temperature and the feel of the tissue as compared to the skin nearby. Pressure injuries, pressure ulcers, bed sores. Immobility reduces the amount of blood that circulates to the skin. Patients who have restricted mobility have increased risk of skin deterioration at pressure points. Define the following key terms. Pressure points. Areas of the body that bear much of the body weight. Bony prominences. Areas of the body where the bone lies close to the skin, and the skin here is at a much higher risk for breakdown. Pressure injuries. Injuries or wounds resulting from skin deterioration and shearing. Also known as pressure ulcers, pressure sores, decubitus ulcers or bed sores. Pressure injuries, common sites. The most common areas are bony prominences, back of the head, ears, the area under the breasts or scrotum, shoulder blades, elbows, lower back, sacrum, tailbone area, buttocks, the area between the folds of the buttocks or abdomen, hips, skin between the legs, knees, inner and outer parts, ankles, heels, toes. The pressure on these areas reduces circulation, decreasing the amount of oxygen that the cells receive. Warmth and moisture also contribute to skin breakdown. Once the surface of the skin has broken down and is weakened, injuries can occur and may become infected, causing damage to the underlying tissue. Pressure injuries, stages. If caught early, a break or tear in the skin can heal fairly quickly without other complications. However, if not caught early, a pressure injury can get bigger, deeper and infected. Pressure injuries are painful and are difficult to heal. They can lead to life-threatening infections, especially in the elderly or ill. Prevention is very important and is the key to skin health. There are 4 stages of pressure injuries. Stage 1. The skin is intact, but it may look red, and the redness is not relieved after removing pressure. Darker skin may not look red, but may appear to be a different color than the surrounding area. The area may be swollen, painful, firm, soft and warmer or cooler when compared to the area around it. Pressure injuries. Stages. There are 4 stages of pressure injuries. Continued. Stage 2. There is partial thickness skin loss involving the outer and or inner layers of the skin. The injury is pink or red and moist, and may also look like a blister. Stage 3. There is full thickness skin loss in which fat is visible in the ulcer. Slough or eschar may be present. Slough is yellow, tan, gray, green or brown tissue that is usually moist. Eschar is a dead tissue that is hard or soft in texture and black, brown or tan, and may be similar to a scab. The damage may extend down to the tissue that covers muscle. Pressure injuries. Stages. There are 4 stages of pressure injuries. Continued. Stage 4. There is full thickness skin loss extending through all layers of the skin, tissue, muscle, bone and other structures, such as tendons. The ulcer will look like a deep crater, and slough and or eschar may be visible. Unstageable pressure injury. There is full thickness skin and tissue loss, but the extent of damage cannot be determined, because it is covered with slough or eschar. Once the slough and or eschar is removed, the injury can then be staged, either stage 3 or stage 4. Deep tissue pressure injury. The skin area is intact or non-intact and is deep red, purple or maroon. The wound may appear as a blood-filled blister. The area may be painful and may be warmer or cooler than the surrounding tissue. Discoloration may be different in darker skin. HA's role in prevention of pressure injuries. Immobility reduces the amount of blood that circulates to the skin. Patients who are bedbound are at an increased risk for skin deterioration and pressure ulcers. Breaks in the skin can cause serious, even life-threatening, complications. It is much better to prevent skin problems and keep the skin healthy than it is to treat skin problems. No. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Report changes you observe in a patient's skin. Provide regular care for skin to keep it clean and dry. Check the patient's skin daily, even when complete baths are not given or taken every day. Reposition immobile patients often, at least every 2 hours. Provide frequent and thorough skin care as often as needed for patients who are incontinent. Use skin protectants. Change clothing and linens often as well. HA's role in prevention of pressure injuries. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Continued. Do not scratch or irritate the skin in any way. Keep rough, scratchy fabrics away from the patient's skin. Report to the supervisor if a patient wears shoes that cause blisters or sores. Avoid harsh soaps or laundry detergents. Report to the supervisor if a patient has these products in the home. Never massage white, red or purple areas on the skin and do not put pressure on them. Elderly patients have very fragile, thin skin. This makes the skin more susceptible to injury. Be gentle during transfers. Avoid pulling or tearing fragile skin. Overweight patients may have poor circulation and extra skin folds. Pay attention to the skin under the folds and give regular skin care. Report signs of skin irritation. HA's role in prevention of pressure injuries. The following guidelines should be followed by HAs to provide good skin care and prevent pressure injuries in patients. Continued. Serve patients well-balanced meals. Proper nutrition is important for keeping skin healthy and intact. Nutrition affects the color and texture of the skin. Very thin patients may be malnourished, which puts them at risk for skin injuries and poor wound healing. Be gentle when moving and positioning them. Keep plastic or rubber materials from coming into contact with the patient's skin. These materials prevent air from circulating, which causes the skin to sweat. The patient's care plan may include instructions on giving special skin care for dry, closed wounds or other conditions. Follow the care plan and ask the supervisor if you have any questions. HA's role in prevention of pressure injuries. For patients who are immobile or who cannot change positions easily, HAs should keep the bottom sheet tight and free from wrinkles and the bed free from crumbs. Keep clothing or gowns free of wrinkles too. Never pull the patient across sheets during transfers or repositioning. This causes rubbing and friction, which can lead to skin breakdown. Place an absorbent bed pad under the back and buttocks to absorb moisture or perspiration that may build up. This also protects the skin from irritating bed linens. Absorbent pads are also available for wheelchairs. Relieve pressure under bony prominences. Use pillows or other positioning devices to keep elbows and heels from resting on the surface of the bed. A bed or chair can be made softer with flotation cushions or special foam overlays. Patients seated in chairs or wheelchairs need to be repositioned often too. Reposition the patients at least every hour if they are in a wheelchair or chair and cannot change positions easily.